Okay, we never just run off and break a baby's clavicle or make huge incisions in the vagina when we have a shoulder dystocia. A shoulder dystocia is when the baby's shoulder gets stuck underneath the pubic bone, which you can see right here. So if the shoulder is jammed in there, it's not going to move very far because the baby can't come down. So we have certain maneuvers that we follow in order to release the shoulder dystocia so that we can safely deliver the baby. If the shoulder is stuck, it's an emergency because the baby can't breathe inside and it stops getting oxygen for mom because the cord gets compressed. So we only have a few minutes to get the baby out, or else the baby can be hypoxic, low in oxygen, and then unfortunately suffer significant brain damage. You also have to be careful with the shoulder because you can't damage the shoulder. So in the past, the first thing we used to do was grab onto the baby's head and just pull down. The problem with that is you can give the baby a brachial plexus injury, which is nerve injury, and then the baby can have permanent arm damage where they can't move their hands or their fingers. And so that can be very significantly negative. So you never grab the baby's head and pull down or pull up. That is a negative. We definitely avoid doing that. First thing you do in a shoulder dystocia, you get the nurses or whoever's helping you to pull the patient's legs back. I can't do that on our friendly model here, but that's the very first thing you're going to start with. It opens up the pelvis, gives you better access to getting in there. Second thing you're going to do, and an episiotomy never even enters our mind at the start of this because it's not really that critical. The second thing you're going to do is you're going to try and deliver the anterior shoulder, the shoulder that's up in front towards mom's belly. So if you follow my fingers, and it's a little hard because this model is rigid, you slip your fingers inside the vagina, you put 2 fingers in the posterior axillary fold behind the baby's arm, you push down, and you can see that I'm just pulling that shoulder out. Now you never hook it into the shoulder because that can injure the baby, but instead you're pushing down against the baby's chest, you pull it down, and then you get your other fingers in the back on the other side, and the same process, and you pull the baby out, and out comes the baby. That's a safe shoulder dystocia delivery. When you can't do that and you're still stuck, the other thing you can do is, if this is mom's belly and you have nursing staff, they can push on the baby's shoulder through the mom's abdomen, not forcefully, but with enough pressure to help get that shoulder down underneath the pubic symphysis. And you again reach in there, so they're pushing like this, and you pull the shoulder out. So as you can see, if you push down from the belly onto mom's belly and on her pelvis, you can actually push the baby's shoulder down. So you just push down there, it scrunches under, and you can then pull the baby out. If that still doesn't work, so you've now got the mom's legs back, it's called McRoberts positioning, you've tried suprapubic pressure, you've tried the anterior shoulder delivery, it's not working, you can actually go for the posterior shoulder first. So sometimes we'll just slip our hands in, baby's head is out, it's stuck about there, you slip your fingers in, and you can get your hands in that posterior shoulder and bring the baby out with the posterior shoulder first and then the anterior shoulder, and then again you're delivering your baby. Finally, if none of that stuff works and you're still stuck and you can't deliver the baby, you do something called a Wood's corkscrew. With a Wood's corkscrew, you take the baby's shoulder and you rotate it. Now you're supposed to rotate it inside, but I actually personally find that quite difficult. So sometimes we rotate it outside, meaning towards the baby's back. But either way, you're going to put your fingers in that posterior axillary fold and you are literally going to turn the baby inside of mom. Now this is a rubber baby, so the arms don't go where you want them to, but you're going to rotate the baby, and in the process of that rotation, you are corkscrewing the baby out, so it'll start to deliver. You now have access for that anterior shoulder, and you can get the baby's shoulders out, and you deliver your baby. I'll show you that one again because it's a little hard to see. So the baby's head is out, you're stuck at the shoulder, you're going to put your fingers in the posterior axillary fold there, and you are going to rotate the baby around and around, and again, this is a dry kind of demonstration. You're going to rotate the baby around. You can then get your other fingers in the other shoulder, and by the time you're there, you've rotated the baby's shoulders out. If none of that works, then you are forced to break the baby's clavicle, which you can do by pressing right there on the clavicle, and if you press hard enough, you will snap it because they're quite soft. That then allows the shoulder to decompress and go down, and you can then deliver the baby. And in an absolute worst case scenario, there's something called a Zavanelli maneuver, which is actually pushing the baby back up into the vagina past the pubic bone, so you're getting the head back inside, and you then have to do an emergency cesarean section. Thank God, never had one like that before. Every good obstetrician has been faced with a shoulder dystocia. The idea that we make huge incisions in the vagina or simply run off to break the baby's clavicle is absurd. We don't do that. We follow the standard procedures. We follow the steps that we've been taught, and almost every single time we get the baby out without any difficulty or trauma. Occasionally it'll take a minute, but we can get those babies out safely, and knock wood, we very, very rarely run into problems.